is in the fight of her life battling a rare brain disease.
As their 22-year-old is battling a rare and incurable disease.
Calls this sweet little guy Trevi. He is battling a rare, incurable genetic disease.
So, I believe that a lot of us fail to realize just how lucky we are to be born normal. In a sense that all of our organs and our genes are doing fine. Some are born with incurable diseases that dictates how their life will be and how long they would live, all because of one defective or mutated gene. It's not fair, and they can't really blame anyone other than God for being born that way. But what if I told you that there may be a way to cure the incurable and give these people the same opportunities that we're given? Gene therapy is a medical field that focuses on the genetic modification of cells for the treatment of diseases by repairing or reconstructing the defective genetic material. In other words, gene therapy may be the answer in treating patients with diseases that do not have any known cures. Without going too deep into how the procedure works, a carrier that contains a modified gene will be inserted into the patient either through in vivo, which is when the patient's cell is still inside the body, or ex vivo, which is when the cell is already outside the body. The modified gene will then be transported to the affected cell and then finally replace the mutated gene to cure the patient. All of this is done without the additional use of drugs and surgery and is typically a one-time procedure. After you're cured, that's it. You're cured. With all I've said so far, you may be asking yourself, why isn't gene therapy a thing yet? Well, there's a lot of reasons. First off, the medical field of gene therapy is relatively young. The idea was first conceptualized in 1972, but the first attempt, albeit an unsuccessful one, happened only in 1980. The problem with gene therapy is that there's a lot of distrust between the public and the scientific community. It's deemed unethical because of how unnatural the procedure is. Who decides which traits are normal and which constitute a disability or disorder? Will only the wealthy be given an opportunity for gene therapy, given how expensive it is? How can you distinguish between the good and bad uses of gene therapy? Even today, gene therapy is still only undergoing clinical trials, with over half of them still in phase 1. So there is a lot of procedures and experiments that gene therapy has to undergo to prove its effectiveness to the public. So my question to all of you is, if you're willing to support gene therapy. As for me, despite all the issues I have pointed out, I firmly believe that gene therapy is the key to our advancement in the medical field. As previously said, gene therapy still has a long way to go before it can be considered some form of normal treatment, like taking medication for your cold. What the field needs right now is a newer generation of scientists and engineers that are capable of creating and improving technology for the development of gene therapy. 20 years ago, gene therapy was still considered very risky because of how the immune system would almost always produce a negative effect on the carrier. Now, as of this year, scientists have just discovered a safer method of transporting the carrier that was tested on 50 children, 48 of which had successful results. It's only a matter of time before we reach that milestone. Would you be willing to support and contribute to achieving that goal?